Happy Memorial Day weekend, everybody. I'm glad to be back for a quick video. I wanted to uh, kind of switch gears a little bit today and talk about people who are struggling with chronic pain who take opioids. And so in my practice, I have, something like 60 patients, I think, who struggle with chronic pain. Some of them take buprenorphine. Actually, the majority of them take buprenorphine for managing their chronic pain. And the other, few of them take regular full agonist opioids. And I consider them kind of pre-buprenorphine because I hope that eventually they can transition off of regular opioids, either by maybe losing weight and changing their program and just not needing opioids anymore, getting a surgery done, or who knows, or transitioning to buprenorphine and tapering off. And the reason I think that's important is because long-term use of full agonist opioids actually makes you worse. And this can be one of the hardest things for people who have started opioids and initially noticed the tremendous pain relief that they get from oxycodone or morphine or any full agonist opioid, to come to terms with the fact that it actually is making them worse as they use it long term can be really difficult. And I just got an email from a patient, and this patient has had long-term pain for 15 years after an accident. And the first time I told this patient that I think that the critical move is to get completely off of opioids, because everything that we tried to reduce pain failed. This medicine, that medicine, this intervention, whatever, nothing seemed to make any difference with the pain. And eventually I told the patient, I think the problem is that you're on opioids, and I think that we just can't make any progress on your pain because the opioids are creating allodynia and hyperesthesia, and I think you need to get off. And of course the patient's response was just to burst out in tears. It was very difficult to think of life without opioids, and so anyway, I just got this email from this patient saying, after 15 years of opioids is finally off, and thank you, and things like, it's good to have my life back. And a friend of this patient noted to me that things are really different, that the person is the person I used to know, and those sorts of things. So even though the initial response to the idea of getting off of opioids may be met with just fear and anxiety and tears, it wasn't easy and it wasn't quick. But for this patient and many of my other patients, in the end, it's thankfulness and relief and return to a better life. And the reason why that's true is because opioids mess things up. And there's two rat studies that I like to tell people about. So the first rat study, they took a plate, a hot plate, and they put food in the middle of it. And they numbered the rats, and they let them in there. And the rats went and ate the food for a little bit, and then they jumped off because their little feet got hot. And they said, okay, this rat can stand on there for however long. And so they tested all the rats, and then they gave all the rats morphine. And they let them go in there again. And sure enough, they could stand on the hot plate for a lot longer and eat their food before they jumped off. But as they continued to do this test, time over time, with the morphine going on, the time that the rats could stand on the plate got shorter and shorter and shorter. And eventually, the rats couldn't even stand on the plate for as long as they stood on the plate the first time. And it makes you feel pain worse. And that is known as hyperesthesia. And then the other rat study that came out later, this study came out a few years ago. The other study was like 10 years ago or longer. This study came out a few years ago. And what they did is they injured one of the rat's legs. And I'm not sure exactly how they injured it, whether they broke it or shocked it or injected it with something or whatever. but it caused pain, and the rats eventually would heal from the injury. And they gave some of the rats morphine, and they gave some of the rats no morphine at all. And they could tell that the rats were having pain because when you stroke the rat's limb, it will withdraw the limb when it's having pain. And so they tested them, and the first group of rats to have complete resolution of pain where they didn't, because rats are like pets, they like to be pet, it wouldn't withdraw the arm, was the group that didn't get morphine at all. They had the most rapid resolution of pain. And although, I mean, I do surgery on people, I do, C-sections and whatnot, and I wouldn't think of not giving people any pain medicine at all. That's not good. I do, in my mind, think this person has to get off of pain medicine pretty quickly, because otherwise they'll end up hurting worse. And that's what the study showed, that the rats who were taking the morphine, their pain resolved very slowly. And for some of the rats, their pain never went away. And they always withdrew their limb in the morphine group. And that is known as allodynia, where things that shouldn't hurt begin to hurt. And it can actually reinforce these pain circuits so that even though you have healed up from your initial injury, your body still sends you pain signals because of the effect of the opioids that you've been taking, kind of locking you in to it. And that's why one of my previous videos I entitled "Opioids Are a Deal with the Devil." Initially, it works great, but then the devil has your soul, and you can't get out because you go through withdrawal and your pain